good morning again, staff. Now, my name is Breda and I'm your trainer for this morning. So could I just get an introduction from you?
Hi, Mark's my name.
My name is Dio.
My name is Teresa.
My name is Anthony.
Okay, welcome. Now, last Friday I did a 30-minute presentation, so we're just going to fly through it quickly again. Here's some handouts. They're slightly shorter than the ones I gave out last week. Okay, so the definition of choking. Choking is when someone can't breathe because food or a toy or other objects is blocking the airway, throat or windpipe. Now, the risk factors: old age, their gag reflex has deteriorated, alcohol consumption, poor dentition, chronic disease, sedation, and eating risky foods. Sedation there is people on medication for schizophrenia. One of the side effects is their gag is reduced. Okay, the causes: eating too fast, failing to chew food well enough, eating with improper fitted dentures, being unconscious and breathing in vomited material, breathing in small objects, injury to the head or face, the after effects of a stroke, enlarging tonsils or tumours of the neck and throat, anaphylactic shock and strangulation. Okay, the symptoms: it's a sudden onset. Okay, that's the important thing. The person may clutch their neck or point to it, and the universal distress signal for choking is that. Okay? Now, the severity: you can have a mild obstruction. The person is able to breathe, they can cough effectively, and they can speak. So what you do is you encourage them to cough, observe and monitor. Okay? They'll clear it themselves usually. Now, a severe obstruction: the person is unable to breathe or speak. They have a wheezy, high-pitched breath sounds, attempts to cough are quiet or silent, they get a bluish skin colour, especially around the mouth, they get loss of consciousness if the blockage is not cleared, and this can lead to hypoxic brain injury or death. So it's quite serious. So the recognition. Because recognition is the key to a successful outcome, it is important to ask the conscious person, are you choking? This gives the person who is unable to speak the opportunity to respond by nodding. In the day centre, so here we need to be constantly observing the clients, especially around meal times. Some of our service users are non-verbal, others have very limited mobility and are unable to make their needs known in an emergency. So staff have to be present at all meal times. No loud music or the radio blaring during meal times. Do not hurry feeding. You alternate bites of food with a drink, and you always place food in the stronger side of the mouth. Now, in severe obstruction, in a conscious person, you stand to the side and slightly behind the person. Support the chest with one hand and lean the person well forward so that the obstruction object comes out of the mouth rather than further down the airway. You give up to 5 sharp back blows between the shoulder blades with the heel of your other hand, checking after each to see if the obstruction has cleared. So it's 5. Now it's called back slaps, but really and truly the position of your hand is like that, okay? And you're going in behind the shoulder blades in an upward jerking movement. Now, 5 abdominal thrusts. If unsuccessful, give up to 5 abdominal thrusts. So you're going to stand behind the victim who is leaning forward, put both arms around the upper abdomen and clench one fist. Grasp it with the other hand and pull sharply inwards and upwards. And then you're going to continue alternating 5 back blows and 5 abdominal thrusts until successful, or the person becomes unconscious.
Excuse me, Rita.
Yeah?
Could you show us the position of the hands for the abdominal thrust, please?
Okay, your hands, okay. Your dominant hand, you're going to close your fingers down like that. Now put them flat out, and then this just meets there, okay? So that's what you're going to use, and then you're going to position your other hand over it and up. Okay, we'll show it in the slides and we'll demonstrate in a few minutes. So there's the position position for the 5 abdominal thrusts. So really, get your belly button, put your fist up over it. That's for the lower abdominal thrust, okay? And then the higher abdominal thrust here under that process, the sigmoid process and the ribs. So that's going to be a high abdominal thrust. You'd use that if someone was very obese or if it was a pregnant lady, okay? Now, an unconscious person, you're going to lower the person onto the floor. You're going to call an ambulance immediately, and you're going to begin CPR, okay? Even if there's a pulse in an unconscious person, start your CPR. Get someone to ring the ambulance. Okay, it's a medical emergency. Someone in a sitting position, you're going to go behind them, get around them as best you can, and you're going to do the lower abdominal. It's a lot easier to do it if the person is standing. Okay, a person in a wheelchair, you're going to do the best you can, right? If it's a person, you see there, she's gone around to one side, she's not going to be able to give a full abdominal thrust, okay? If she can get down behind her and get her arms around her, which isn't always possible, it's a much better position to get the abdominal thrust. Now, the 2-person abdominal thrust. I have linked in here one of our service users, and she's going to help us. But we just go through the slides first. You see the position there? Position from the side, and that's the position your hands are at the back of her wheelchair. Okay? And then, if it's a 1-person abdominal thrust, and the person is in a wheelchair, you're better off putting the brakes on the wheelchair, or putting the wheelchair back against something like a wall, going down to the side of the person, and you're going to use the position for the back slaps, and you're going to get in under here, and give her a jerk up. And 5 of those, and hopefully you should clear it. Okay? So do you want to practice the 2-person abdominal thrust? Linda, if you would come forward. Okay. Do you want to come with me? Okay? Oh, you're a great actress. Okay, so the position is hand down, thumb like that, and now Tracy, you're going to grasp onto my hand. Okay, and that's going to be the lower abdominal thrust, and you're going to jerk up. Higher abdominal thrust, jerk up. Okay, now if you're on your own with the person, I'll give you all a chance to practice this. Okay, so you're on your own. Is your brakes on? Yes, you're very good. Okay, so if I'm on my own, so it's this position, it's going to be like the back slap. You're going to kneel down in front of her, you're going to go here and up, 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 and up. And hopefully she'll regurgitate whatever is causing her to. Good woman. Okay, so do you want to go into pairs and practice that? Now do you want to practice the 2 together as well? Margaret, for that one, put your hand like that, you'll have more power, and you're using this. Okay. No, you're using that part of your hand. Oh, right. Stoop down in front of her, you'll have more power. Yeah. Try and get the heel in lower there. Okay. And in. Sorry now. Yes, we don't want to do it too much. Okay. Theo, you probably know what to practice that one. Do you want to practice the 2? Theo and Andrew, will you practice the 2? Yeah, now try and bend that. Okay, Theo, you bend your hand. Yeah, thumb down like that. So you're going to go there or there. Here, just here. Okay, and you're going to give 5 upwards. Okay, okay, perfect. Okay, there's no need to be embarrassed. I mean, you are saving the person's life, even if it's a fella that's doing it on a woman.
Yeah.
It's always better to do something than to do nothing. Now, is there any more questions? Are you all happy with that?
Yeah. Yeah.
Yes.
Yeah.
Yeah.
Yeah. And if you're on your own, okay, Teresa, can I just have your chair? Say you're on your own, you're down in the house, and Teresa, you eat an apple. And next thing, what you do is, you lift the chair like that, well it's like this actually, sorry, and you like down over it, okay? Or either that you'll run against the countertop, you'll do anything.
Just something that'll capture the same
Catch it, yeah, as a kind of an abdominal thrust.
Yeah, very good.
You know? So, I mean, this should be taught for all transition year students, really. Okay? And the biggest cause of choking in, say, teenagers is the binge drinking, inhaling vomit. That's it. Okay, any more questions? No? Okay, thanks very much.
Thank you.
Thank you.
Thanks, Linda, for participating.